Hi, my name's Demi. I'll be the student nurse that's working with you today. Can you tell me your name and date of birth? Good, I see that on there. And you don't have any allergies, correct? Okay. So the doctor ordered me to come in and access your port. I'm going to go ahead and do that. I know that they're doing a blood draw in a little bit, but right now we're just saline flushing it. So I'm just going to take a look at your port and palpate. Are you having any pain at all? Good. I don't see any redness or swelling at all. It's not warm to the touch. Go ahead and palpate. So I can feel that it is not a power port. It's not triangular, and there's no bumps on the top. Go ahead and take these gloves off. And then put a pair of clean gloves on so I can set my tray up. So now that my table has had time to dry, I'm going to go ahead and set up my tray. So I have my Huber needle that has a PosiFlow attached to it, and I checked and everything is in good expiration. So I'm going to go ahead and open up my needle, making sure it stays sterile. And I'm going to connect my pre-primed saline flush. And then I'm just going to prime my PosiFlow and my needle. And I'll just set this off to the side so we can use that again later. Then I have my BioPatch and my tray. I'll go ahead and open this up. And I have my sterile gloves. I'm just going to set those off to the side since I don't need them right now. And at this point, I would put my mask on, but I already have one on, so my patient needs to put their mask on. If for whatever reason they didn't want to put their mask on, they could just turn their head away from the area so they're not breathing and coughing all over it. So I'm going to go ahead and open this up. Just going to throw that right in the garbage. And then open up my tray. Making sure it stays sterile. Then I'm going to take my BioPatch and I'm just going to kind of flick it on there, making sure it stays sterile. And then I'm going to put on my sterile gloves, making sure that I'm not turning my back to my field at all. Okay, so I'm going to start with my dominant hand. Pick it up and put it on. Keeping my thumb up when I'm putting on my non-dominant, making sure not to drag it all. Don't want to contaminate my thumb on my wrist at all. Okay, so now I can go ahead. I'm sterile. I can reach and grab my ChloraPrep. So I'm going to go ahead and do that. And I'm going to be cleaning my site for 30 seconds this way. Crack my ChloraPrep. Okay, and now I can do 30 seconds this way. And finally, 30 seconds this way. Then when I'm doing this, I'm making sure that I'm not reaching across my sterile field at all, making sure that it's staying as sterile as possible. 30 seconds has passed. So I'm gonna go ahead and just drop this, and I'm gonna give that some time to dry, probably about 30 seconds while I get my needle ready. So I'm gonna go ahead and reach with my non-dominant hand, making sure I'm not crossing my sterile field at all. I'm going to pull out my syringe with my flush and my needle attached. Then I'm gonna go ahead and take the cap off of my needle. Okay. Then I have my needle. I'm gonna go ahead, I've given it 30 seconds to dry, so I can go ahead, take my sterile hand and make it my clean hand by touching my patient. So I'm just gonna pinch the port, and you're gonna feel a little poke. Okay. So now my needle is in. You go ahead, unclamp. So I'm just gonna flush using push pause. I'm gonna flush a little bit. And then I'm gonna aspirate for blood return. Is everything feeling okay? Good. So I don't have a blood return, but if I did have a blood return, I don't have a blood return, but for practice reasons, we're gonna pretend that I do have a blood return. But if I had trouble getting a blood return, I could have my patient kind of cough, move their arm a little bit, move around, get the blood flowing. But now I'm just gonna flush using the push pause method. And if I saw swelling at all, I would stop and I would call my provider. Okay, so now I can go ahead and clamp and disconnect, and then I can just drop. I'm going to alcohol off for 15 seconds. Using friction. Okay, 15 seconds has passed. So then at this point, what I could do is I could use heparin and connect my heparin, and then I could connect my infusing. But then since I'm just locking it, I will dress it now. So I'm gonna go ahead and grab my BioPatch, and I'm putting my Blue to the Sky and placing that right behind my needle. And then I would take my transparent dressing. Some facilities use a shirt, and so they put the shirt on, and then they put their pants on, making sure they're not covering the patient's nipple at all. But for practice reasons, I'm not going to put my transparent dressing on. And then I would want to document. I'm going to document my date and my time, how my patient handled the procedure. I'm going to document what the site looked like, that I have my BioPatch on, my transparent dressing. I'm going to document what gauge needle I used. I'm going to document if I had good blood return. I'm going to document if I'm locked or infusing, and then I'm going to document what I flushed with and if I had trouble flushing at all. And then I would document if I have a cap on the end, because some facilities have you use caps, but for practice reasons I don't have one. And then I would make sure I'm taking all my supplies out and putting them in the proper place, taking my gloves on, taking my gloves off, and washing my hands.